Hi, my name is Marissa Loya, and today my research topic will revolve around understanding the role of cultural identity and care quality in miscarriage experiences among Latina women under the guidance of my PI, Dr. Isabel Almeida, as a part of the Latina Perinatal Health Lab. To begin, it's becoming increasingly recognized that compassion in healthcare isn't always distributed equally, and that's especially true for Latin communities. For Latina women in the US, navigating the aftermath of a miscarriage can mean facing broader structural factors such as acculturation, language barriers, socioeconomic status, cultural disconnects, and a lack of empathy or cultural understanding from providers. These inequities are especially concerning given just how common miscarriage is in the US, as miscarriage is one of the most common forms of pregnancy loss, affecting 50% of pregnancies in the first trimester due to chromosomal abnormalities. While these biological risks are well documented, growing attention has turned to the social determinants of health, such as race, ethnicity, and economic disadvantage, as compounding influences. Additionally, many Spanish-speaking Latina women who experience early pregnancy complications report receiving minimal care and limited information, often resulting in their experiences being treated as routine medical events. Despite these intersecting challenges, Latinas' experiences remain underrepresented in reproductive health research, highlighting critical gaps in culturally responsive care and the urgent need for tailored health interventions in this population. This raises an important question in my research question. How does the quality of healthcare received by Latina women following a miscarriage shape their experiences of care, and in what ways do their cultural identities influence these experiences? To examine how cultural identity and healthcare quality shape Latina women's miscarriage experiences, we conducted 50 in-depth semi-structured interviews with self-identified Latina women who experienced a miscarriage within the past 5 years. Participants were recruited via social media and Prolific and were required to complete an initial screening survey to ensure eligibility. All interview materials were made available in English and Spanish, and the interview portion of the study was recorded via Zoom after obtaining consent from participants, and with these interviews, rough transcripts were generated. Following data collection, I will analyze interview transcripts and ultimately conduct a thematic analysis to identify recurring patterns, themes, and tensions within participants' experiences. Ultimately, the goal is to elevate voices that are often too overlooked in reproductive health conversations. By better understanding the needs and values of Latina women navigating miscarriage, we can begin to push for more culturally competent care, care that meets people not just as patients, but as whole individuals shaped by their identities, communities, and histories. This work matters because compassionate, inclusive care shouldn't be a privilege, it should be a right.